I'd just like your attention to the front as I do the next introduction. Thanks. Now, in this introduction, there are some really large words, and Dr. Tremlett said she put those in her resume just to see how I would do. But I'm pleased to introduce Dr. Helen Tremlett. She is a PhD. She is the Canada Research Chair in Neuroepidemiology and Multiple Sclerosis and professor at the University of British Columbia in Vancouver. She told me she moved there in 2001 from the UK, in the Faculty of Medicine in the Division of Neurology. Dr. Tremlett's research program is funded through operating grants from the Canadian Institutes of Health Research, the MS Society of Canada, the MS Scientific Research Foundation, the U.S. National MS Society, among others. She is trained in pharmacoepidemiology and multiple sclerosis from a PhD from Cardiff University in the UK. Her research interests include the natural history of MS, prognosis and predictors of disease progression in MS, mortality, safety and effectiveness of the immunomodulatory drugs. I didn't quite do that. For MS, pharmacogenomics, MS epidemiology, incidence and prevalence of MS, life expectancy in MS, comorbidities. She is also dealing with the MS Prodrome. Does everybody know what a prodrome is? I know she's going to be speaking to this. I looked it up. It's an early sign or symptom or symptoms which often indicate the onset of a disease before more diagnostically signs and symptoms develop. So that's a prodrome. I'm going to speak to that. She's also going to talk about the gut microbiome. She's authored over 150 peer-reviewed papers. Amazing. So please welcome Dr. Tremlett, who will be speaking to research insights from the MS Prodrome to poop and beyond.
Thank you so much for that kind introduction. Fabulous. And I'm a little bit upset you got all the long words right. Okay, can I get this pointer right? So, it's a real pleasure to be here. Thank you very much. And yes, I am based in Vancouver, and this is a picture of my commute to work, and it's always sunny. Not really. So, I'm pressing the pointer and nothing's happening. Oh, here we go. So here's my outline. Here's what I'm going to talk about today. So my broad theme at the start will be showing you how the MS Society of Canada funding really puts Canada at the forefront of MS research. And I just want to tell you how important it is to have a society that is focused on a specific disease. It means a huge thing for us in the world of research. And I will be showing you as many pictures of beautiful British Columbia as I possibly can. Although, man, your flowers, your leaves here, your autumn leaves, aren't they stunning? That is quite something. So I'll show you work from my group, and I'll show you how the MS Society of Canada has really invested in cutting-edge research, which has really paved the way forward, I think, to improve outcomes and make a difference in MS. So I'm just one researcher. And my group is at the University of British Columbia, and I'll be showing you what we've been doing recently. We'll be talking about the MS Prodrome, and I'll be asking you guys what you think about the MS Prodrome. We'll get there in a minute. And then, I hate to break it to you, I will be talking about poop, so the gut microbiome. So I'm glad we've done with lunch, and it's going to be a ton of fun. And then I will finish up on a couple of slides just showing you firstly, studies that my group have published in the last few years. We'll talk about cancer risk in MS, cancer risk with some of the MS disease-modifying drugs, pharmacogenomics in the context of trying to prevent adverse effects to the MS drugs before you even start a drug, and looking at aging in MS. And then I'll finish up saying what studies we're working on currently. So MS Society of Canada really does, funding really places Canada at the forefront of MS research internationally. And here's a picture of a beautiful campsite on the Sunshine Coast in British Columbia, if you're interested. So I came to Canada in 2001, and I came because of the MS Society of Canada. They funded me just for 1 year as a postdoctoral researcher, and of course, as soon as I got to Canada and got to Vancouver, I never wanted to leave. And I just want to point out as well that when you do fund one researcher, and I know you guys do a lot of fundraising related work, and that's really appreciated. When you fund one researcher, they go out and develop a whole team of researchers who are all focused on multiple sclerosis. So just these are pictures of my group. So these are really smart young men and women who have dedicated their careers to trying to tackle multiple sclerosis from all different angles. So it means a huge difference, and I'm just one researcher. This is my group. I'm really thrilled that some of the people in the picture, now they have faculty positions, and they've now moved to other provinces. We've got one in Saskatchewan, and Karina Kowalek, who's just moved to Manitoba. They're now developing a whole team of researchers in MS, so it has a huge ripple effect. So thank you guys, and thank you for those who do all that fundraising. So as researchers, all of us really try and make the donor dollars go further. So just as an example, for every $10 the MS Society's ever given me for research, I've used that and leveraged that to bring in almost 100 additional research dollars. And so how do we do that? So the MS Society, because they've invested as us, as young researchers, we're then able to go out and get money from other foundations like Michael Smith Foundation, get funding from Canadian Institutes of Health Research. I'm now funded by the Canada Research Chair Program, so the MS Society doesn't have to pay for me anymore, which is nice. We get a lot of money, a good investment, I should say, from the US National MS Society, because Canada is such a cool place to do MS research, and I'll show you in a little bit, and also money from the UK as well. Okay, so back to the outline. We are going to move on now to the research, and we're going to start with the Prodrome. Okay, so this is audience participation. What the heck is a prodrome? Well, actually, you just got a very nice definition. Who's never heard of a prodrome, or even the MS prodrome? Oh, I'm seeing, lots of hands. Oh, you're going to have some fun here. Well, I hope you're going to have some fun anyway. But I'm really interested as to what you think. You've got to think about this. So, definition that you heard earlier of what a prodrome is was spot on. So it's an early symptom indicating the onset of a disease or illness. And so specifically in the context of MS, we are looking before our classical understanding of MS symptom onset. So I hope I'm going to make this clear, because I want to ask you guys if you think, if you have MS or you know someone with MS, if you think you had a prodrome. So let me kind of describe it again, what we're interested in. We're not interested necessarily in the time before MS diagnosis. We're interested in the time before MS symptom onset. So when you go get a diagnosis, say a typical scenario might be that you talk through with your neurologist, and he or she will go through your clinical history, and then you will kind of, assign a date. Sounds very, but there'll be an acknowledgement that your MS symptoms probably started on such and such a year or such and such a date. Does that kind of ring true? Okay, so that's MS symptom onset. So we are interested, and this is what we looked at in this study, we're interested in symptoms that occurred before then, that in hindsight you think were actually part of MS. So is that making sense? So now, of course, now I want to ask, So what do you think? Did any of you, when you think back before MS symptom onset, were there any symptoms you were having that in hindsight you actually think was multiple sclerosis? Anyone, any thoughts? Okay, thank you. So I'm curious, thank you. It's a big room, I know. So I'm curious, any symptoms people had before MS symptom onset?
I just got diagnosed this year. I'm a patient of Dr. Delia Ronstein at the MS clinic at St. Mike's. My prodrome started when I was, I would say, roughly 14, and I am now 34.
Can I ask what symptoms? What makes you think?
I had electric shock.
Electric shocks? Okay.
Down my legs, and this went on for a year.
Okay.
My family doctor thought maybe it was a vitamin B12 deficiency. Then also I had numbness, facial numbness and hand numbness for years, intermittent.
Okay. And so thank you for sharing that. Any other few quick ones? I'm just curious.
First time I started to get some numbness in my hand, and they thought it was carpal tunnel.
Okay.
And investigated for that, and then pinched nerves, and you know.
Okay. Thank you.
Oh, am I on now? Oh, there we go.
We'll do one more. Go on.
At the age of about 16, I got the feeling where I couldn't feel hot and cold. I could pick up the curling iron, and I knew it was hot, but it felt cold to me. I didn't have the temperature differentiation.
Okay.
And I could get in the shower, and I knew the water was hot, but I couldn't feel that. The doctor as well thought I had a vitamin B deficiency. Mm-hmm. And of course, with the vitamin B, and then it went away, but then it came back a few years later, like the band around my waist.
Okay, so temperature sensitivity and then the band around the waist. Okay, thank you. Okay, should we do one more?
For 3 summers in a row, when I was maybe 13, 14, 15, I fell 3 times, well, once each summer. Once was jumping over a 1-foot-high barrier. Once was just on an uneven sidewalk. And it was always my left knee. And it's my left side, many years later, that is affected by MS. Mm-hmm. So I wonder.
So falling. Oh well, I want to hear everyone's story, but hang on to what you're thinking, because I'm curious then when I show you in a moment what we found, how it rings true and what it means to you. So hang on to those thoughts. Okay, so before you start any study as a researcher, you have to get funding. And we actually struggled to get funding for this particular study. We had to try a few times because a lot of reviewers said, well, you're not going to find anything. You're not, why are you bothering to do this? You're not going to find anything. So I was trying to figure out why we were getting this, you're not going to find anything. But when I walk into a room of people who have MS, they will all give me a story. And it's a very challenge, and they'll give me a lot of different symptoms. So we were convinced there was something there. Okay, so why were some people saying, well, there's nothing there, there's no point in funding this study? So I actually went back and picked up kind of like a lead MS medical textbook that was current through until about 2000. So it wasn't that old at the time I wrote the study to try and get funding. This would have been in around 2012. So what do you think? When I picked this book up, did they say there was an MS prodrome? So multiple choice now. Did this textbook on MS that a lot of the researchers and physicians were reading, did it say there was a prodrome? So are you a yes? Are you a maybe but need more evidence? Or do you think they just said no? What do you think? Kind of led you down there. Does anyone want to say anything? Does anyone want to say anything else? Okay, that was a bit of a leading. But it's interesting though, isn't it? So it made me understand why people didn't really believe this thing existed, because even this textbook, I was actually surprised they even had the word prodrome in there. And they just flat out said, no, it doesn't exist. Okay, so we're up against a bit of a barrier. So as researchers, this is what we wake up every day thinking. We might have a cool idea. We think it's a cool idea anyway. We think it'll be meaningful and it'll be useful for people with MS. So how would you go about doing this? If there's this belief that this thing doesn't exist, there is no MS prodrome, how do you measure it in a really convincing way? It's not convincing enough to get a bunch of stories from people, unfortunately, to say when they thought back in time, they could come up with these different symptoms. How would you do it in a way that would really convince people that the MS prodrome existed? I'm just curious what you think you might do. Again, as researchers, this is what we do every day. Anyone, any thoughts? Take a bunch of histories? Yes, but you have to do it in a way, recall bias is the big problem. So, meaning that it's fine to ask people to think back in time, and it made us convinced that this thing was real we were trying to measure, but you have to measure it in a way that's really, really convincing and isn't just asking people to think back in time. But you're getting somewhere. I like your thinking.
What about a questionnaire at a certain age?
Yeah, so I mean, in the ideal world, right, that everyone in Canada would be given this questionnaire every year of their entire life, and then you could then look back and be pretty confident you got that information. But a questionnaire, again, have this problem with recall bias, which means when people think back over a certain period, I can't remember what I had for lunch last week. I can't remember what I did, a year ago, where people really might recall things that were not quite as they happened at the time. And it gets really difficult to get a control group to compare that to who haven't thought back in such detail. So there's issues with that. Do you want me to put you out of your misery and tell you how we did it? But I like it. You're all thinking. We got loads of hands coming up. Should we do one more?
I guess I was thinking in terms of countries. I mean, we could talk about Canada, but what's happening in, I don't know, Japan or England or Australia?
That's a cool question as well.
Yeah.
I mean, in terms of... Maybe come back to that at the end. In terms, if you're talking globally about research, I've got a lot to say on that. But you're right. You want to do studies in all these different places to see what's consistent. But that's a big question. Maybe we'll come back to that at the end. So, in terms of the MS prodrome, I kind of go, well, it's like people think the world is flat and you've got to convince them that it's not. How do we go about doing it? Well, we could do this because we're in Canada. So in Canada, you have a universal health system, and across many of the provinces in Canada, as researchers, we can access, in a very controlled and anonymized or de-identified form, we can get access to, on an individual level for every person, every prescription that was filled at an outpatient pharmacy, every hospital visit and the reason why, and every physician visit and the reason why. So while I'm talking you through this slide, really what you've got to be thinking, or I hope you're thinking, is health data in Canada is amazing. But it's a big process for us to go through this. It takes us typically about a year and a half to get all the approvals in place to get access to answer our specific study. And it's very well controlled by all the ministries of health. You have to go into a certain very secure virtual environment so they can monitor what's being done with the data, and what gets presented has to go back through them every time before we present or publish anything. So it's a very strictly controlled situation. But what it enables you to get access to is information that was prospectively collected, and then we can look back in time and know that that information hasn't changed. That hospital visit can't be forgotten or remembered because it's there in the medical record, and that's all stored electronically. So this is what we did when we looked at the MS Prodrome. And so we specifically looked at 5 years before people first developed symptoms of MS. So we looked in the 5 years before MS symptom onset, not just diagnosis, but MS symptom onset. And we found that you could measure a prodrome. So we found that in the 5 years before MS symptom onset, people were more likely to access the health system compared to similar people without MS in the general population. So we match people who don't have MS from the general population by age and sex and wherever they live and the calendar year as well. So people 5 years before they developed first symptoms of MS were more likely to fill a prescription, visit a hospital, be hospitalized, or visit a physician. So, of course, this was our first paper, and this was published in Lancet Neurology 2017, if anyone's interested. But then, of course, the real question is why? What were people doing? And this comes back to the question I was asking you guys earlier. What did you recall as your MS prodrome, if you think you had one? So what do you think we found? Now we're accessing health data, so people had to have accessed the health system. What do you think we found? I'll let people maybe think about that one. Oh, we got some hands raised. Okay, sorry, can we do the microphones again? What do you think we found in this data? So we're looking at prescriptions filled, hospital visits, and physician visits before MS symptom onset.
Falls and cramps.
Falls and cramps. Fatigue, I heard fatigue.
Optic neuritis.
Bowel symptoms.
Bowel symptoms. Vertigo. Pain. Bladder. Bladder-related issues.
Numbness.
Numbness. Upper respiratory tract infections. Have you guys read this paper already? You are seriously spot on. So let me jump to the chase and tell you what we found. So we found in the 5 years before MS symptom onset, people were more likely to have bladder-related issues, to fill a prescription for a bladder-related drug or to visit a physician. And this is actually a picture. I took it from a toilet door on Cortes Island, one of the Gulf Islands, and it just really made me laugh because that is exactly how I felt at that moment. Bladder-related issues, they're more likely to be diagnosed with anxiety or depression, and there were 50% more visits to a psychiatrist. And this is in the 5 years before first MS symptom onset, compared to an age and sex-matched general population who did not have MS or who did not develop MS. So it didn't stop there. There were many, many more things, as you guys have recognized already. We also found that people were more likely to access the health system for pain, fibromyalgia, headache and migraine, irritable bowel syndrome, sleep disturbances. And this was a quirky one, more visits to a dermatologist. In fact, a paper we just published this year, we were trying to figure out if the MS disease courses differed in terms of the prodrome, and here we were comparing people who had developed relapsing remitting MS versus primary progressive MS, and the only thing that differentiated them was that people with relapsing remitting MS had more visits to a dermatologist, and we were completely confused by that. We thought, well, maybe it's a chance finding, which is possible, but it's really interesting when you go and look at the literature and realize that because relapsing remitting MS is associated with inflammation, that may actually be manifesting maybe as more of these skin conditions, which were then driving people to visit a dermatologist. Of course, we don't know that. We don't know that's the scenario, but it's very intriguing. So Some of you may be thinking, or I hope you're thinking, okay, well, this is interesting, but what the heck are you going to do with this information? Like, so what? Well, there's 2 huge so whats. Actually, there are 3 huge so whats. So one so what is some of these findings give us insight into how MS starts, and therefore it may give us insights into what may trigger MS. So it gives us insights into how MS starts, but it also shows us that we can actually measure this in a tangible way. So we can measure higher healthcare use in the 5 years before clinical recognition of MS. And it begs the really interesting questions. Can we actually identify MS earlier and maybe even manage MS earlier? So you heard this morning from Dr. Mark Friedman all those different drugs that are on the market or that are in development. And we're hoping that with time, if some of those drugs are really shown to be neuroprotective, that if we could then identify people earlier, maybe we could actually manage the disease even earlier. Maybe you could even get to the point where you could prevent people who have got these early fuzzy symptoms from actually developing MS. I mean, they're big questions. And they're big, lofty goals, but that's something I would like to try and do with this information, but it's not going to be easy. Because obviously, you've heard all those symptoms we just talked about, and a lot of them are very general, right? Fatigue and pain. It doesn't mean you're going to develop MS. So packaging these things up in a way then that is actually meaningful is going to be a big goal and something we would like to work with. Other neurological diseases like Parkinson's, they're working really hard on these areas to try and enroll people in clinical trials even before they've developed full-on Parkinson's to see if they can really manage the disease better. We would love to do something similar for MS. So that's a big, lofty goal. What can we do with this information right now for us as researchers or myself as a researcher? It tells us that if we want to know what causes MS, we have to be really careful to remember this MS prodrome. So if I want to know what causes MS, I for sure know that I don't want to look at that 5 years before MS symptom onset, because people may actually already have MS. They've already changed their behavior. You can see this in the medical records. Another interesting finding, which again I interpret as meaning that people have already changed their behavior because they know something's going on. We can see in that 5 years before MS symptom onset that women are less likely to get pregnant and are more likely to fill a prescription for an oral contraceptive drug. And you can even, you can really see it particularly the year before MS symptom onset. Now, historically, people have found those kind of things and said, oh, well, then maybe maybe pregnancy then will prevent MS, and maybe oral contraceptive drugs cause MS. Well, actually, no, neither is correct. And packaged up with everything else, I say that a better interpretation is that people already know something's going on. They don't know it's MS, they haven't been diagnosed, and they're changing their behavior to take that into consideration. People realize there's odd things going on, and they're choosing then to do certain things or not to do certain things. Does that make sense? So this information for me is really important if you want to know what causes MS. And in case some of you are wondering, what about before 5 years, or why did you only look at 5 years? We only looked at 5 years for various reasons. You can ask me that later if you like. Part of it was a funding issue, but do we think the prodrome goes back further than 5 years? Absolutely. I mean, I heard a lot of the stories already that, from you guys this afternoon, and you're telling me things that happened when you were 13, 14, 16. We think this prodrome goes back further, and that's something else we want to, now we've shown you can measure this prodromal period, we want to go back further in time, which is actually challenging in of itself. Okay, how are you guys doing? Oh, yeah, before I forget, this work was really led by Jose and Tanya, and I guess I'm just highlighting that it's these young, smart kids, they're probably in their 20s or 30s, who do this work, and I really want to acknowledge the contribution they had with my group. Okay, so where are we on the outline? We've done the prodrome. We're on to the poop. Okay, what on earth has poop got to do with multiple sclerosis? I'll be talking about the gut microbiome in kids with MS. So I totally want to know who has never heard of the microbiome? Getting some hands, you are going to have some fun. You are going to have some fun this afternoon. Okay, and I hope have many of you heard of? Thank you very much. So those of you who've not heard of the microbiome, you're going to leave here a changed person, literally. Okay, so what is the microbiome? Your microbiome, we all have one, are all the microbes or the bugs that live in or on you. You are teeming. You are a host for bacteria, fungi, viruses, and so on. In fact, you're coated inside and out with trillions of friendly microbes. And if you like counting cells, I hate to break it to you, but you're only actually half human. So half of your cells are human and half of them are microbes. Who knew? Isn't that cool? Isn't that so cool? You won't look at yourself in the mirror in the same way again, will you? Now, most of these microbes, about 90% of them, are in your gut. Hence, we're going to be talking about poop, stool. And I want to get you super excited about the gut microbiome. So these are just a couple of stories to get you thinking about the microbiome. And we will come back to multiple sclerosis specifically afterwards. So why am I showing you a plate of sushi? So when they first started sequencing the microbiome of people, when it became affordable to do it, which wasn't that long ago, so this research has only been going really for the last decade or so, because we can now actually afford to sequence the microbiome and stool samples and skin samples and so on and so forth. But when they did this, actually this comes back to the country piece, what's going on in other countries, they realized that people in Japan had a specific microbe in their guts that seemed to be borrowed from the oceans. So this microbe, the genes in this microbe, actually came from the sea, and they were really confused. They could even find it in babies in Japan, yet they weren't finding it so much in Westerners, people living in North America. They realized that over millennia, people in Japan had acquired this microbe from the sea, and it enabled them to break down sushi. So it enabled them to break down the seaweed in their diet. Isn't that insanely cool? So we can borrow microbes from different places to do cool things for us. I think that is just amazing. They've actually found this microbe now in other communities, like in Wales, that also have a strong history of eating seaweed. Isn't that cool? Okay, elephants. Why am I showing you pictures of elephants? Does anyone know what the word coprophrasia means? I'm so glad you've eaten lunch. Coprophrasia. We got a hand, we've got a knowing nod. To eat poop, to eat feces. So baby elephants eat the feces of the herd, and why they realize they're doing this is they're actually seeding their guts with the microbiome of the herd, which then enables them to digest the diet that the herd are eating. Isn't that so cool? So don't do this at home. As humans, we acquire our microbiome through different routes, and I'm afraid eating feces is associated with psychiatric conditions, so just let's not go there. Probably not so good. So other super cool things about the microbiome, and now bringing it back to why we're interested in multiple sclerosis. So did you know that over 90% of your serotonin is produced in the gut? So this is kind of nature's happy drug as such. Some of the antidepressants are meant to try and kind of increase your levels of serotonin in the brain. And we used to think that serotonin primarily was produced or functional in the brain. No, 90% of it's in your gut. Your microbiome also produces vitamins like vitamin K and some of the B vitamins. And probably most importantly, perhaps, it also regulates your immune system. So your gut microbes are constantly in communication with your immune system and vice versa. So your immune system needs to know what you've just stuck in your mouth. And is it likely going to cause you problems? And your gut microbes are also very happy living in your gut. They're having a good time. It's warm in there. You feed them. Life is happy. So they're constantly telling the immune system, we're the good guys, leave us alone, we're fine, don't get your army out, don't attack us, life is good down here. So it's a constant communication. And there's a constant communication between the gut and the brain. And you all know this. You've all had that gut reaction to something, whether it's good or bad, where you almost feel it in your stomach first. You know, the butterflies in your stomach or whatever it is. You have a direct connection between your gut and your brain through the vagus nerve. But the two communicate through many different ways. Your microbes break down your food and produce metabolites, which can then influence the brain. And then your microbiome will influence your immune system, which then can go and influence your brain and so on. So you start to see now where the connection is with MS and why we're really interested in the microbiome. Okay, so I said I'd talk about the gut microbiome and children with multiple sclerosis. So fortunately, MS is very rare in children. We think that less than 10% of people will develop and are diagnosed with MS in their childhood years, and childhood years meaning under the age of 18. But studying children can be a very powerful means of looking at what may cause MS or drive the disease, because unlike the typical adult, kids have been exposed to fewer things. They've done fewer things, which can make it easier to uncover what might have caused MS or what drives MS. And so what I'm getting at here is, can you imagine, on average, typical adult will present with MS, say, might get their first symptoms on average around age 30. I mean, there's a huge range, but just say on average age 30. Well, if you want to know what causes MS in that person, how on earth are they ever going to remember back 30 years? You know, what did you eat 10 years ago? What did you eat last week? How much exercise did you do? You know, so on and so forth. It's really difficult. Now, it's not to say it's really easy in kids, but they've got less of a history, and there's some reliability more from getting it from parents who know what the kids have done. So it can be, you have fewer things to root through to try and figure out what may have caused MS and what drives the disease. Okay, so it is extremely rare, thankfully. So I was lucky enough to go down to San Francisco, UCSF, University of California, San Francisco, where they have a pediatric clinic down there, and Dr. Manuel Walbont is the neurologist, and she had the huge foresight to have collected stool samples on kids with MS and kids without multiple sclerosis. And she let me go down and analyze their samples. And so these are some of the findings I'll share with you now. It's a very small study, so it's definitely not the definitive study. We call it a pilot study, where it's given us insights on where we should go next. So these are very preliminary findings I will show you that have been published in the last few years. So multiple choice. Does the gut microbiota composition, so your gut microbes, do you think it differed between these kids that we were looking at with multiple sclerosis compared to kids who did not have MS? So these kids on average were they were 12 years of age on average. This is a very small study, but I'm just curious, what do you think we found? So multiple choice, are you yes, we found differences between the kids with MS and the kids without. Are you a no? Are you a no idea? Got some yeses. You're like, yeah, you better have found something. Otherwise, why are you standing there? Anyone, anything else? Okay, I just heard yes. I have maybe no idea. Well, I'm being mean. The answer was yes and no, because I've not told you how we go about measuring the gut microbiome. It's actually not easy at all. How do you quantify something that's full of trillions of microbes? It's actually really difficult. But I will try and give you an insight as to how we do it. So yes and no. We found some differences, but not others. Okay, so what did we find in children with MS when we compared the gut microbiome of children with multiple sclerosis to children without? We found that they were largely similar in terms of diversity of the microbes. So I'm going to give you a garden analogy, so I really hope this makes sense. If you can imagine, it's like your gut is an ecosystem. So it's teeming with life. They're all having fun down there. They're working together as a community. And it's not like the kids with MS had this sort of devastated garden where there was nothing in there were no microbes, or they were all incredibly sick microbes. No, it didn't look like that. It looked more like this. So where the kids with MS and the kids without MS looked like they had flourishing gut microbiomes or flourishing ecosystems. They were pretty diverse, and so we couldn't say there was a difference between them. They both looked like pretty healthy gardens, healthy microbiomes. Does that make sense? Okay. But when we looked up close, as if you go into this garden and you start looking under the bushes and whatever, when we looked up close, and we looked at individual microbes that were in the guts of these kids, we did find differences. So for individual groups of microbes, and we were focused on bacteria mainly, it was almost as if the kids with MS had significantly more weeds than the kids without MS. So by weeds, I'm meaning that microbes that looked like they were pro-inflammatory, that may be kick-starting some of the inflammation or maybe just harboring some of the inflammation that was going on in MS. I hope that analogy works with you guys. So we saw differences in terms of the individual groups of microbes that were in the guts of these kids. Now, word of caution, this is a pilot study. It's a small study. There were 38 children in this study. But it's given us the insight and the drive to move this forward. And I'm really thrilled to say the MS Societies of Canada has funded a larger study, again, looking at kids with MS. And it's a collaboration between Canada and the US. It's a huge number of sites, 23 sites in Canada, and a vast network as well in the US, just in order of so we can get enough children involved and we can gain stool samples. And I'm hoping I could come back in a year. It's really complicated data. I'm hoping I can come back in a year and give you some actual findings, but at the moment we're frantically sequencing the information at the moment, and you get vast vats of information when you're looking at the microbiome. So before I leave the microbiome, because it is extremely cool, we did have a second question we asked in this pilot study. So we were actually really interested if the composition of the gut microbiota, so the microbes that were in the guts of these kids with MS, was it associated with their future risk of a relapse, of an MS attack? So I will just jump straight in there and say that, again, this was a preliminary study. It was published 2 years ago, and I would say that preliminary evidence suggests that there may be a relationship. And specifically, we found one group of microbes. The name is actually not that important because we need to validate these findings. It happened to be fusobacteria. We found that depletion of a specific group of microbes called fusobacteria in the guts of children with MS was associated with earlier relapse. So if any of you like Kaplan-Meier curves. A lot of actually clinical trials published their work with Kaplan-Meier curves. Actually, Mark freed them this morning. Pretty much every curve he showed you, or graph like this, is a Kaplan-Meier curve. So in case you're utterly thrilled to leave this room knowing what a Kaplan-Meier curve is, I'm going to show you. So here we have, I hope this works with the pointer, we've got time along the bottom. So this is time here in days. And so at the study start, which, hold on, I'll point and then come back. So study start there, time 0 is when we had the stool sample from these kids. Then we moved them forward in time, followed them over time. In the ideal world, none of these kids would have had a relapse. This study only included kids with MS. In the ideal world, no one would have a relapse, and the line would be flat. So this would be good if everyone was like this. So flat along the top. So if you were flat along the top, that would be marvelous. No one had a relapse, life was good. So what we found is you could split this group into 2, depending on whether they had fusobacteria or not. And the kids who did have a greater abundance of this fusobacteria were less likely to have a relapse when we followed them over time, whereas the kids that had more of this fusobacteria were more likely to have a relapse during the follow-up. I hope that now makes sense. So again, the name of the microbe doesn't mean so much here, because we do need to show this is real and we need to validate it, and we're doing that right now. But again, it's given us the incentive to move forward, and has enabled us to get funding to do this in a much bigger study. So it's too early to break open the fireworks, although they look pretty cool over the Golden Gate Bridge here. We need to confirm those findings, and we're working really hard right now to do this. Okay, fun fact before I leave the microbiome behind. This is just a silly fact. Okay, so how do we get stool samples? Actually, that's a really interesting question. And I was utterly thrilled. I put the phone down one day and realized I'd spent an entire hour talking about how to ship shit across Canada. Sorry to say that word, but it was just so much fun to think about logistically, how do you do this? And we had to trial and error a lot to figure out what worked. And in the end, we used Canada Post. Because that actually turned out the most convenient. And it's amazing, right, as researchers, you're always really keen to get your samples in really quickly. And it's amazing when you go down to the mailroom in the hospital and you say to the mail people, you know, I'm really looking for this parcel. Could you tell me if it's arrived? And they just go, yeah, you and everyone else. You go down and you go, so we've got these poop samples coming in. Could you tell me when they arrive? Oh man, they appear at your door. They do not want stool or poop sitting around in their mailroom. So that was really fun for us to realize. So go on, guys, what do you think? Were kids posting their poop to Toronto, Ottawa, Winnipeg, or maybe you don't really care? What do you think? Who do we like the least? Send it to the big smoke, right? Send it to Toronto. It was actually Winnipeg. They've got the National Microbiology Lab there, and we've actually now got a biobank of stool samples up there. We've actually got samples we shipped over up from the US as well on ice, which is nice, or liquid nitrogen to keep them cool. Okay, I'm almost done. We're almost finished. So get those questions going. So I'm going to, last couple of slides, I'm just going to summarize other work that we've been involved with, and this is all published work, and then I'll show you what else we're working on. So in case you're interested, some studies that we published in the last few years. So one interesting question we had, what is the cancer risk in people with multiple sclerosis? And I am sharing this one with you because I think this is a finding you might be quite intrigued with. We found that cancer risk is actually lower than you would expect in people with MS. And this was published in 2012 in Brain. Now, this was a study out of British Columbia. But it's nice to see that a lot of other countries and areas worldwide also show a similar finding. Now, I just want to say it does not mean that if you have MS, you cannot get cancer. I'm afraid it does not mean that. It just means that on average, the risk of cancer does seem to be lower in the MS population. It still means that you can get cancer, though. It does not mean that the risk is absent. So obviously, I encourage everyone to continue going to the cancer screening programs that's appropriate for you and that's available in your region. But it is really interesting to see this. And of course, I'm interested in why people think that might be the case. So part of the reason we asked that question originally is that really, we wanted to know if the current drugs for multiple sclerosis altered cancer risk. So we've done this now just in looking at one drug, beta interferon, because and that would be Avonex, Rebif, beta-seron or beta-ferron, depending on what country you're in. So we specifically looked at the beta interferons, partly because they've been available for many years, and you need long follow-up on people to look at cancer risk. You saw some of the work this morning that Dr. Mark Friedman presented, and as he was alluding to, you actually need to follow people for a long period of time before you really know whether that particular drug might alter the risk of cancer in an individual. So we looked at it in context of the beta interferons. And again, I was really pleased that we did not find anything. We did not find evidence that beta interferon exposure altered cancer risk. Actually, interestingly, before we went into that study, we weren't actually sure if the beta interferons would lower cancer risk or increase cancer risk. We just didn't know. But we found no evidence that the beta interferons altered cancer risk. We are now moving forward to do similar work looking at the other MS drugs as well. I have a large drug safety and effectiveness program, and so we're really interested in trying to prevent side effects before they occur. So here's another question we had. Are we any closer to actually preventing side effects to the disease-modifying drug? And really thrilled that we got a paper published last year, and that we were able to find a genetic marker in saliva. This is pharmacogenomics. So we could find a genetic marker in saliva, people with MS, that may help us identify who is at risk of a side effect or an adverse effect from a drug. We were specifically interested in liver injury with beta interferon, but to be honest, it could be any side effect. We needed to prove that we could do this, because until this study was published, no one had been able to do this in MS. So of course, then my dream is, we're trying to push this study forward to look at other side effects of the newer drugs for MS. But my dream is that one day you could walk into the neurologist's office and you could spit in a tube, and maybe you could poop into a flask as well. But so you can get access to the microbiome, and your neurologist could instantly sequence it and come back and say, well, maybe you should consider this drug over that drug, because you might be at a greater risk of getting this side effect, and maybe you'll actually benefit more from taking that drug. And so maybe to make that therapeutic decision-making a little easier, that's my dream anyway. We're obviously some way off from doing that. So how does MS impact life expectancy? Life expectancy has massively increased in MS over the years. It's actually increased at the same rate it has in the general population. So on average, we've done a lot of incidence and prevalence and mortality studies now across Canada. And on average, the average person living with MS is now in their mid-50s, which is a lot older than it used to be even 10, 20 years ago. And so for us as researchers as well, it's made us realize that we really need to focus on healthy aging in MS, which is something that we're trying to look at as well. Okay, I'm almost finished. Just last slide with text, and then we'll go on to acknowledgements and questions. So what are we working on right now? So we've got, as I mentioned earlier, we have banked a lot of stool samples from children and youth with and without multiple sclerosis, funded by the MS Society of Canada. So I hope I can come back maybe in a year or so and give you some of our findings, but that study's ongoing right now. I have a large drug safety and effectiveness program funded by the Canadian Institutes of Health Research. So we're looking at long-term safety and side effects and effectiveness of all the MS disease-modifying drugs that are out there. And this is a collaboration across 5 provinces in Canada. I mentioned aging with multiple sclerosis just earlier, so we're really interested in looking at how other conditions that people with MS will naturally develop over time, how that might impact the MS itself and what can be done about it. So this specific study, we're looking at cardiovascular heart disease in multiple sclerosis, and we're looking at how prevalent it is, and if and when people with MS get heart disease, how does that influence their MS, and how is their heart disease treated? With the overarching philosophy going into this study is that maybe, if we could manage coexisting diseases in MS better, that maybe we could actually have a really positive impact in MS, maybe more so than the MS disease-modifying drugs do. I don't know. But we're trying to see if there are other things other than just the MS drugs that may benefit people with MS. And this is a lot of work we do with Dr. Ruth Ann Mary, who is a neurologist in Manitoba. And who is a workaholic, and her husband is a cardiologist, and for fun on the weekends they write grants and papers together. Oh dear. But she is a lot of fun to work with. I can strongly advise working with workaholics because they are highly productive. We've got a lot more other studies going on, but I will wrap up and give time for questions. Oh yes, so here's a frequently asked question. Now, I'm not a nutritionalist, I'm not a dietitian, but a lot of people want to know, okay, so what's the best diet for MS? What's the best diet for my gut microbiome? So, drum roll please, while I unveil to you the best diet. Follow the Canada Food Guidelines. So they were actually updated this year, and in context of the microbiome, you don't need to sequence your gut to know what's healthy for you, just listen to your grandma. Plenty of fruits and vegetables. They say your gut microbiome likes all the colors of the rainbow, and no, that's not like Cheetos and all the I want to say crisps, what do you call them here? Chips you get in the supermarket. No, we're talking fruit and vegetables. That's what your gut microbes really like. They like fiber. So the Canada Food Guide is actually pretty cool, and there's a lot of evidence in that Canada Food Guide that will benefit health in general. And I heard a nutritionalist say this, and it did make me laugh. She said that, you know, people are always wanting the next radical diet. She said, you know what, if everyone actually followed the Canada Food Guide, that would be really radical. For most people, this is a radical diet. So think about that and look at that. I think that picture says it all, and look it up. Half your plate should be fruit and vegetables. There you go. So I just really want to say thank you very much to my team, the picture of my group, my funding bodies, my collaborators across Canada, and of course all the people and the kids with MS who've contributed to this work, and their parents. It's really appreciated, and thank you all those who ever taken part in research. Again, it's really appreciated. So just leaving you with some pictures of beautiful British Columbia, Garibaldi Lakes, which is just an hour and a half outside of Vancouver. And I'm really happy to take questions. But don't ask me what she's doing. I don't know. Thank you for your attention.
Thank you,
really
Dr. Tremlett. Thank you. So, as before, the opportunity is for you to either write your question on a piece of paper and provide it to our runners, Casey and Natalie, or email me at msconnectontario@mssociety.ca. And again, if you have difficulty with writing, we can pass you the microphone. So I do have a couple of questions. Now, you did answer the first one, which was what can we eat, or what would help? But I'm just curious, though, yes, a good diet is important, but is there anything we should actually stay away from?
Oh, I hate being restricted. I think, you know, everything in moderation, right? Again, I'm not a nutritionalist, but from what I understand, you know, everything in moderation. I mean, don't do hard drugs.
Probably a good idea.
Wear a seatbelt.
And have you ever considered the association between the Epstein-Barr virus, mononucleosis, and MS Prodrome?
Oh, that's a really interesting question. Let me get my head around that. That's a big question. So Epstein-Barr virus is a very common virus. In fact, I don't know, over 99% of us, 97% of us in this room will have Epstein-Barr virus. You'll have been exposed to it and you won't even know. So as humans, we lived with Epstein-Barr virus. We've lived with Epstein-Barr virus for millennia. And in the ideal world, probably you should get it when you're about 2 or 3 and your granny or your aunt kisses you. You get exposed to Epstein-Barr virus. You don't even know. And you have the antibodies for life. Now, the thought is that if you're exposed to Epstein-Barr virus in your later years, meaning teenage years, it's more likely that your immune system will react oddly to it. And that will present then as mono. In the UK, we'd call it kissing disease, but here I think it's mono. And that's you as a teenager getting Epstein-Barr virus a bit later in life and your immune system not liking it. That presentation of mono is associated with an increased risk of developing MS. It's a very small increased risk, very small, and people still argue whether it's that person was going to develop MS anyway and it's just their overactive immune system, or if the Epstein-Barr virus actually causes MS. It's a tricky one to tease apart. And I'm still not really getting to the question. Epstein-Barr virus during the prodrome. I think this is a question, actually. It's a philosophical question that I'm still struggling with, is when does the prodrome stop and when do we start looking at risk factors for MS? And I don't know the answer to that. I'm not sure anyone does. Could the Epstein-Barr virus be part of the prodrome? Maybe. You know, I don't know. And I think it's too premature for me to say either way, but I think it's a really interesting question. I hope that wasn't too long-winded.
That's okay with me. If you are someone that follows a whole food diet, should you be spending your money on probiotics, or is the healthy diet sufficient?
Absolutely, the healthy diet is sufficient. Probiotics, I wouldn't bother right now. There's not. So I don't know if you're aware, when you go into that supplement aisle of the supermarket, it's huge, right, and overwhelming. All those supplements in there, including probiotics, are not regulated like other medications are, which have to go through rigorous, Health Canada approval or FDA approval. They're not as well regulated. And that the same goes to the probiotic industry as well. Okay, what is a probiotic? It's a very cool concept. So a probiotic, in theory, is your gut microbiome, let's just pretend, is somehow, we know that it's somehow lacking some microbe, and the theory would go is that you could package up whatever microbe you needed into a pill, and you could swallow it, and you could then inoculate yourself with this microbe that you're missing. Well, we're far from knowing how to go about doing this and how to do it in a safe way and what microbes people are really missing. So we're a long, long way from even going there. So that's what a probiotic is. Now, just to get you really realizing that it's the Wild West out there when it comes to probiotics, if you decided this afternoon that you want to manufacture your own probiotic, you could register it tomorrow, and you could get your probiotic on the shelves of a supermarket, as long as you don't make any you can't make any big claims that you're going to cure any disease, but as long as you can show that those microbes have been consumed by humans and they're safe for humans to consume, you're good to go. So most of the probiotic supplements will include live bacteria that have colonized things like cheeses and yogurts. So we know they're safe for human health, or we hope so, and they'll package those up and sell it as a probiotic. So it's a very interesting area, but they're quite expensive. And so I personally wouldn't waste my time on them. There are some probiotics that do have some evidence that they may accelerate recovery from when you have diarrhea, particularly associated with antibiotics. So there are some probiotics that have been shown somewhat useful for that. Go talk with your pharmacist, because they'll know which ones have got the best evidence behind them. But in context of taking probiotics for MS or general health, I wouldn't bother. It's an area of interest, don't get me wrong, and we would all love to be able to package up a probiotic, a microbe, and give it to people and make a difference. So many researchers would love to do that, but we're not there yet. So I hope that was a sufficient enough answer.
I'm going to now ask you some questions related to children diagnosed with MS. Did you look at the microbiomes of siblings of children with MS, and what did you find?
Oh, that's a really cool question. We actually, in short, no, we've not done that. We thought about it. We actually wanted to get controlled children who were not a family member, because you have a little bit of an issue. I think it's more of a theoretical possibility rather than reality. You have a theoretical possibility that the sibling may in later years develop MS themselves, and you don't really know if they do or they don't have MS, and to maybe give them an MRI. So we wanted to avoid that. But I think it's broadly an interesting question, and in research you have to be very focused with your question and not ask too much at once. So it's something I think would be really interesting to do, but no, we've not done it. Okay. And no one else has published anything on that either.
So are we at a point of testing all children in Canada, especially if there is a difference? So my assumption this question means testing them related to their microbiome, not necessarily testing them if they have MS.
The answer to both questions would be absolutely no. MS is so rare in kids, there's no point. There's no test anyway. There's no point, there's no test. That would be a useful screening test, no. In context of looking at the microbiome, no, there'd be no value in doing that. In case you're interested, you can, for fun, don't bother doing this for health reasons, but for fun, you can go and get your microbiome sequence, like $99. You can go, say, to the American gut. We've just launched a Canadian gut, which I can talk about if you're interested, but for $99, you can go send off your stool sample, and they'll send you back a profile, but it will not tell you, it will not give you any health advice or anything like that. That's why I'm saying it's for fun. It'll just show you how your microbiome looks compared to other people who've contributed to the Canadian gut or the American gut. So it shows you how similar you are to people of your sex or your age, or who drink alcohol or who don't drink alcohol. So it's just for fun. It can't give you any health information, unfortunately. I'd love it if it could. And in case you're wondering, no, we don't know what a healthy gut microbiome is. As it turns out, many communities across the world have very different gut microbiomes, and they're all doing fine, thank you very much. So it does seem that your microbiome will is very regionally dependent, so it will look like the people that you live with and the communities that you live in. Actually, if you really wanted to know, if you have a dog in the house, your microbiome will shift towards looking like the dog's as well, and that's not necessarily a bad thing. And your microbiome will share similarities with your partner. who you've lived with for many years, and so on and so forth. And the further you get away from people, then the less microbiome you will look like others. So it's a very interesting field, but we don't know what a healthy microbiome should look like. That diversity is the only thing that seems to be a good thing, meaning you want lots of different microbes so they can all do different things for you. But the microbiome is fairly adaptive.
Okay, I'm going to try to get this question correct. So in this study you did with children, again in their microbiome, was any findings suggested that there was diets that linked to the diagnosis of MS? That's part one. Or depletion of the fusobacteria?
Yeah, it's a really interesting question. Our study was too small to tease apart how much impact the diet had both on the microbiome as well as the potential, say, risk of MS or relapse. But I have a PhD student right now, and that is one of his big questions, is to look at the relationship between diet and MS and the microbiome to see if he can tease those things apart. There are some I think maybe I'll just leave it at that because there's a lot we need to uncover in there. But you need, as you could imagine, you need a lot of information to look at this well. Diet's really complicated. Even getting good information on what people have eaten is really difficult. But we've got a big bank of stool samples from kids with MS, and we've got some really good diet information on them, and we are going to try and look at that trivalent relationship, diet, microbiome, and MS, and risk of relapse in MS as well.
Okay. So what might be the effect of antibiotics on gut biome?
Oh, yeah, so antibiotics, yep. Antibiotics can do great things for you. So if you do have an infection that is bacterial, then antibiotics can be absolutely life-saving. They can be a little bit destructive on the microbiome as well. So I did mention, for example, that there are some probiotics that seem to have some benefit in terms of accelerating recovery from diarrhea that you can sometimes get with antibiotics, but speak with your pharmacist about that. They're not cheap either. So when they've done studies, people taking antibiotics, it does seem that your microbiome can recover after a course of antibiotics. It kind of depends on which antibiotic. Although they have shown that if people have multiple hits of multiple courses of antibiotic, the microbiome can take a hit from that. I mean, the real question is so what? Does it matter for long-term health? And we don't know the answer to that question. But it will, antibiotics unfortunately will kill off good microbes, but fundamentally they'll kill off the bad ones too. So you may actually survive your infection, but your microbiome is a bit of collateral damage in the process. So antibiotics are life-saving, are important, but don't overuse them. I think that's the best advice that all physicians would give.
Are you able to answer a question related to research connecting Lyme disease and MS?
Oh, Lyme disease and MS. I mean, that's a very, it's an interesting topic. Lyme disease, as you're probably quite aware, is endemic in particularly areas such as, I mean, I know it's spreading up across the country, but it typically came out of New England in the US, and there's obviously that city called Lyme, where they first discovered it. And some of the symptoms of Lyme's disease can mimic MS, can seem similar, so the fatigue piece and those kind of aspects. One of the differential diagnoses for MS, meaning when you go and diagnose MS, you need to rule out many other things, and Lyme disease will be one of the things that the neurologist will think about. Fortunately, it's still very rare in many regions. But obviously it is problematic in other areas. So in short, is there a connection between Lyme disease and MS? I would say no, other than that they share, there's some similar symptoms, but they're very different diseases. So with Lyme disease, if you catch it early, you can actually treat it pretty well with a course of antibiotics. but they're very different conditions. We know what causes Lyme disease. We still don't know what causes MS, but they're very different conditions.
So this individual says they've heard consistently that wheat is inflammatory and harmful to the body. What can you say about that?
Yeah, I know. You can get these books called like Wheat Belly or something. I wouldn't suggest you read it. Okay, so if you're intolerant to a food item, fair enough. You know, if you have celiac, so you need your gluten-free diet, fine. But this general notion that somehow we've all become completely intolerant to foods that we've eaten for many years, I think to me is kind of strange. It's not to say that some people are very intolerant, and life is not fun if you're intolerant to a food item, right? But don't exclude something from your diet just because you think it might be healthy. Excluding things is not a good idea. If you want to go that route, I would say, talk to your physician. No, there's no evidence that one food item is particularly bad for us, but yes, some people are insensitive, and to be insensitive to a food item is not fun. And to exclude something from your diet is not fun, and it can be expensive, and I wouldn't advise you do it unless you have to.
And is there a relationship possibly between the MS prodrome and radiographically isolated syndrome?
Oh, yes.
And meaning that in this situation, they were diagnosed with that, and it was about 6 years before their diagnosis of MS.
So we're talking about evolution of the same disease, right? So in my mind, anyway, this is how I have it in my head, is that, shall I go backwards or forwards in time? Maybe I'll go backwards. So you're diagnosed with MS. I'll go back in time. You had MS symptom onset. So before that, we have this symptomatic phase that we've now recognized that we're calling the prodrome. But if you could go even back further in time, and now let's just say we had MRI scans on everyone in the population, which, by the way, I do not think would be a good idea, but let's just say theoretically we did. Some people who've had an MRI scan, an imaging scan for other reasons, sometimes come up with these lesions that look like MS, and that's what they call radiologically isolated syndrome, where it means, it's a weird word, but it basically means that you have a spot on your MRI, and we don't really know what it means, and you don't seem to be having any symptoms, but let's just monitor you and see what happens. And so because MRI is being used more commonly, say particularly in the US, for sometimes reasons that it shouldn't be used, they are picking more of these cases up, and there are obviously now some in Canada as well. And it's a very challenging question to know what to do at the moment. In Canada, my understanding is that radiologically isolated syndrome would just be monitored to see if anything happened to that individual. If they were going to develop MS, over time you'd think they would then enter the prodrome, so they would start to develop symptoms, but wouldn't yet really be what we classically understand as being MS, and then maybe ultimately they would then be diagnosed. Maybe they won't. In fact, as you age, you can, I think someone asked that question this morning, as you age, you can come up with spots on your MRI, which can actually look a bit like MS. So personally, I would not go get an MRI done unless I really had to, because I don't want to know I've got aging spots. If they're not causing me issues that I'm aware of, then I don't want to know.
Has there been any correlation between celiac disease and MS?
Oh, yeah, interesting question. I can't think of anything off the top of my head specific to celiac, but
maybe you can answer it in tandem with this one, though. Other comorbidities or other confounding factors also.
Yes, so we do know that, and we've published quite a lot of work on this now. We do know that people with multiple sclerosis are at an increased risk of developing other comorbid conditions. So anxiety and depression is a big one. They think that people with MS, say, lifetime prevalence of anxiety or depression would be about 50%, so it is quite a big issue. But there are other comorbidities that people with MS are at an increased risk of, and that's why we are particularly interested to look at this question to see if we can understand how to manage these comorbidities, these other conditions, in a way that would then optimize that person's overall health and therefore would optimize their MS as well. So trying to move away from just treating MS as just in that silo of MS, but to try and be a bit more holistic and think of the person with MS and everything else that may be going on. And that's something that we're trying to work on right now to answer the overarching question of, if you manage someone's comorbid conditions, these other conditions, well, could you actually benefit that person with MS, say more than taking a disease-modifying drug, or in a similar manner than taking a disease-modifying drug? And it's an intriguing question, and we're trying to work on that right now.
Okay, so I'm going to make sure I also get this question correct. You spoke about the cancer risk in MS was less than you expected, but what was expected? If you expected 90% but only get 80%, is that still less than expected or very much still a risk?
Oh, that's a good question. So you want absolute risk out of me, don't you? And it's actually really hard to answer that question. So we're talking relative risk. And I could get really geeky and spend the next hour talking about risk. But it's a brilliant question because we're talking about relative risks. So when I say lower than we would expect, what we do is you take someone with, again, this was this health medical records linkage, you take someone with MS and you match them, you compare them to someone of the same age and sex, living in the same region, the same calendar year, and you look at what the risk of cancer in that individual is and what the risk of cancer in the person with MS. And so it's relative. So it's relative to someone who's similar to you in the general population but doesn't have MS. It's not absolute risk, which means that, and it's actually really hard to sometimes get down to absolute risk. So I suppose what I would say, what would we expect? We were looking at the how each individual compared to someone in the general population. So that's what our expectation was that people with MS would look the same as people in the general population, but their risk was somewhat lower. Again, I'll just re-emphasize, it doesn't mean that you cannot get cancer, it just means the risk is somewhat lower. I really want someone to ask, why is that the case? Because I'm sure you're all thinking that. And there are many reasons potentially why, and none of these answers I could give you are the truth, but one area I'm really interested in, and if there are any emerging immunology-related researchers out there, think about this. Is it something to do with the immune system in MS? I'd love to know the answer to this. Is it something to do with the immune system in MS that it's maybe a bit overactive, and that's why maybe that person developed MS, maybe, but that overactive immune system maybe is more likely to clear cancerous cells when they occur. There's some statistic that every year each of us will develop 1,000 cancerous cells, but your immune system will get rid of them before they take hold. Well, maybe people with MS are actually just better doing that than people without MS. I don't know the answer to that, but isn't it intriguing? And I would love to know.
So I'm going to end up with just two more questions, but two of them I have to tie together. So the question is related to, is there any benefit, back to what you can ingest, for the gut microbiome as a result of maybe eating or drinking fermented foods like kombucha? And sort of add to that then, is there anything we can be introducing to the gut for those who may have sick or something that's not present, somehow of introducing something? And I've heard of some theories related, you talked about the fecal, but I've heard some stuff about that.
I guess
anyway, that wasn't the question, I'm adding that to it. So basically, is there, again, back to kombucha or fermented foods, or is there some other way we can introduce a healthy biome into an unhealthy biome situation?
So there's a lot of interest in fermented foods. I don't have anything really specific to say other than there's a lot of interest, and people do. I'm trying to think if they've actually shown long-term benefit. But there is Bottom line is, with fermented foods, they're unlikely to do you any harm. So if you're into kombucha or whatever, or you like your fermented kimchi, go for it. Why not? If you like it. If you don't feel guilty that you don't like it. It may be beneficial. Is it beneficial in context of MS? I can't tell you. Is it really beneficial in terms of your overall health? Don't know. If you like it, why not? Personally, I don't like kombucha and I'm not going to drink it, but that's just me. So the other one was something introducing...
Can you introduce something into an individual who may not have a healthy...
Yeah, so this goes back to this question of what's a healthy microbiome? We don't know. A lot of people are very healthy and they all have different microbiomes, and we do need to understand that better. Is there something you can introduce specifically to MS? No, not that we know of, but we'd be really interested to find if there was something, and that's why we're all working in this area to try and get to that kind of goal. Some of you may have heard of fecal transplants. If you haven't, you're going to be utterly horrified. This is just totally brilliant. So fecal microbial transplant, by the way, not for multiple sclerosis, but I'm just giving you a general insight. Fecal microbial transplant, it sounds exactly like it does in the tin. Introducing feces to your body. Introducing feces, you can either go through a nasogastric tube, or you can come in through the other side. It's actually been approved now for use to treat Clostridium difficile, which is really nasty, essentially really nasty diarrhea that people can often acquire in the hospital setting when they've had a lot of antibiotics. So this is nothing necessarily to do with MS. This is a completely different condition, so really chronic diarrhea. And people can die from this, Clostridium difficile. And they've shown that when they don't respond to conventional therapy, that fecal microbial transplants can be really beneficial. And yes, there are some hospitals that bank stool and will bank your stool as you enter the hospital system, so that if you get Clostridium difficile, they can give you your own feces back when you leave. Again, through the nasogastric tube, and yes, apparently it is a bit smelly because literally they take poop and they liquidize it and then they pop it in through a tube, and they apparently say suck a strong mint during the process. People are obviously trying to move away from that because there's risks of introducing at least someone else's stool. If it's your own stool, fine. But introducing someone else's stool is not without risks, can be a risky procedure, and people are trying to create poop pills. So like you encapsulate the microbiome, and people take it that route. But again, at the moment, it's only been shown useful in Clostridium difficile, but it's not to say people aren't interested in trying to treat other conditions. Other conditions have just been a bit more challenging and haven't responded as well.
So one more question, and that's it, about poop before we leave for our afternoon snack. In your poop samples, or in poop samples, one goes and gets a poop sample, can you identify parasites and silent infections in your gut?
Oh yeah, that's a really interesting one. So sequencing, in short, yes you can, but sequencing isn't cheap either. So it's getting cheaper. As it gets cheaper, we can actually ask more questions. But where the science is focused, most of the science is focused to date, ours included, is we sequence a little marker on these microbes. And we're very good now at sequencing bacteria and archaea. And getting at the other pieces like viruses is actually really difficult. And so, and you can sequence parasites as well. It's just more challenging. And we actually have a pilot study funded by the MS Society where we're going to do what we call shotgun sequencing, where this will enable us to look at everything in there, but it's not an easy task. Because you may have trillions of microbes, and a lot of them are bacteria, but you have gazillions and gazillions of viruses who live on your bacteria. So they feast off your bacteria who are kind of living on you. And so it goes on. There's a huge community of microbes in your gut, and we really don't understand everything about them. So not there yet, but we have some funding to look at viruses and other things that are going on there in the gut.
So thank you very much. Stay up here because Rob's coming up. If you do have further questions for Dr. Tremlett, she will be at this table for a little bit longer during our break, as well as we have Maheen at the back who can address some of your questions related to research in general. Thank you.
Thanks for your attention, everyone. Really appreciated.
Stay here. Thank you, Dr. Tremlett. I have to say, you've given us a lot to digest. I just came up with that, just standing right there. Anyway, so I'm really happy to know I've got trillions of happy, friendly microbes coursing through my body right now. And I'm happy to know the significant role that Winnipeg plays for us in receiving our poops for research. Didn't know that. But I'm also happy to understand the work that you're doing around the Prodrome. And can we get more insights into what are the early causes of MS? And from that, can we get ahead of the curve in terms of identifying and then initiating early management of MS, possibly earlier stages in life? I think that's brilliant area of research, and we wish you all the luck as you proceed further with some of the studies that you've talked about today. So on behalf of the MS Society, everyone here, thank you so much for your insights into areas of research. Thank you.